Hi, Jessica.
Hi.
Well, let's go into the office so we can have our conversation in privacy.
Thank you.
So, before we get started, I wanted to let you know everything that we talk about is confidential. It's going to stay in between us unless you're a threat to yourself or you're a threat to others. Then, of course, it's my duty to warn, and I will have to let a supervisor or someone know what's going on.
Okay, I
Do you
understand.
have any? Do you
No,
have any questions?
I don't think so. Not about that.
Okay, so today is it's like our boring session, like when you go to the doctor for a doctor visit and they ask you questions. So that's what today is going to per se. And may I get your date of birth?
11690.
Okay, what brings you in today?
Well, my husband encouraged me to come in. Um, he says that I have certain behaviors and tendencies that cause him distress. Basically, I like things a certain way, and I'm very conscious about bacteria and germs, and he just wanted me to come talk to somebody about that. He thinks it's too much.
So what I'm hearing is that your husband wanted you to come in because it's causing him some distress of some of your behaviors that is happening. Is this around the house?
Yeah, it's around the house. It's when we go out to restaurants, public places, anywhere that I don't really have control over.
Okay, what is happening during this time when you said that it's certain behaviors when you go out and you don't have control, what behaviors are you having?
Yeah, I just get really hyper focused on how clean a place is or if things are in their correct spot. And I think it really deters from um, how enjoyable our time out together is.
How long have this been going on?
I feel like I've always been this way since I was a kid. I like neat and orderly things, but now that I'm over 30, I think it has started to get a little worse. And I don't know if that's with age, but definitely I'm more set in my ways.
When you say set in your ways, can you describe what you mean by set in your ways?
Yeah, I'm just more vocal about how I want things. I don't have time to be getting COVID or the flu or any of those things. Like, I'm very busy. Like, things need to be clean.
Do this affect your daily life as in going to work, going out, or anything?
I mean, I would say it keeps me going out. It keeps me having fun because I'm not getting sick. But I think he would say that it prevents me from living like my true life.
You're true. How is so he thinks this is causing you not to be yourself, is what I'm
Correct.
hearing.
Yeah.
So do you have like when you're out and you feel that the air or something's not as clean, do you feel any tightness in your chest, any numbness in your hands and your legs?
I definitely start to get like hyper focused on those sort of things. My heart rate increases. I become what I would say is like overstimulated, and I want to just everything to be quiet so that I can come back down from that state.
Before, when you said this happened as a kid, when this was happening as a kid, do you get any kind of treatment for it? Do you see a therapist or anything about the behaviors?
No, this is my first time speaking to anyone in general about anything.
Okay, well, I'm glad you took the first steps to come in and have this conversation. Is it a family history of any kind of mental illness or a family history of anxiety, moods, or anything of that sort?
None of my family has ever sought help for any of those issues, but I would say that, there's some depression. Um, I guess probably just mainly depression that runs throughout my maternal side.
Would that be your mother,
My
father?
mother, her sister, my grandmother, just the woman on that side seem to struggle with that.
So it's the women that you believe that struggle with depression.
Hmm.
Okay, so have there ever been a history of substance use amongst yourself or even a family history?
No, I've never used any drug except for alcohol, and I only maybe have one or two drinks a week, if that. So not on me. On my family side, I know my dad smoked a lot of weed, but other than that, nothing too exciting that I know of.
Do you feel like that ever affected you or affected any kind of behaviors that you may present?
Well, my parents divorced when I was very young, so I didn't really see my father as much. But when we did spend time together, I don't think that had much effect on the time we spent.
I hear that you talk about your mother and your father, um, and they did divorce. What age was it when they divorced?
I think I was like 4 or 5. I don't remember it.
Okay. Do you have any brothers or sisters or
No, I'm an only child.
the only child? Okay. So are you from here or did y'all move here?
We moved here about 5 years ago.
Where
Um,
did you move from?
we came from California, so we came pretty far into the middle of the country for work.
For work? Do you when you was in California, was you having any of these behavior or did they start when y'all decide to move?
I think they were not as significant back then.
Okay. So when we talked about your family history and that's you believe that there is some depression on that side. Um, have you had any, you said this your first time coming to therapy. Have you ever been hospitalized or anything for anything?
Not for mental illness. No, I did have to go have surgery on my wrist a couple years ago, but that was has been my only hospitalization, thankfully.
And may I ask what happened with the wrist?
I was just working out and I fell and I just landed on it very hard.
When you fell, do you have any head injury during that time?
No, no head injuries.
What about allergies?
Seasonal stuff. I try not to take any medications, so I kind of just get through it. But definitely, I probably like reacting some of this to some of the Midwest pollen that I'm not used to out here.
Okay. When you said that you don't take any medication, is there a reason why you don't take medication?
No, I don't believe in medication. I don't think that we should be putting things in our body that aren't natural.
Okay. Thank you for letting me know that so no medication. Have you was you medicated or anything as a child or anything? Is that your culture?
No, I don't think it has anything to do with my culture, but my mom was always very cognizant of the health aspects.
Okay, thank you for sharing that with us. Um, do you have any children or anything?
No, we don't have kids yet. My husband keeps talking about it, but I just don't know if I'm ready to like invite that kind of chaos into my daily life.
Do you feel like having children will you say you like everything your way and you're set in your way. Do you think children will have effective change things?
Yeah, I mean, I visit my friends who have kids and they always are apologizing for things everywhere, and I just can't imagine living like that.
Okay, so don't want to change. Um, have there like been any other family stressor going on that may had lead to any of these behaviors?
Now that you mention it, it's probably just the talk of family that's making me more controlling. I think
Was anybody in your
husband, yeah, I think my husband's ready for that stage, and it just makes me nervous.
does it when you're nervous, how are you feeling when you're nervous?
Like things are out of control, and I need to come back to like homeostasis.
When you're feeling like you're not in control, how do you bring yourself back?
By cleaning.
By cleaning.
Mhm.
Okay, so today we have went over just a summary of everything based on the DSM TR5. I think you have is it's called OCD. Have you heard of that?
I've heard of it a little bit, but I don't know much about it.
So for with this, we're not going to do the diagnosis at this moment. We're going to continue to work together if you would like on coming in weekly, and we can do some prolonged exposure. And what in that prolonged exposure is, we will start tackling. We will see what your sub levels are, how your behavior is, and how are you feeling on a, like, it's like a temperature scale from 0 to 100, and then we will be able to start exposing you to some of the things, as maybe touching a sink with your hands and seeing how you feel at that time. Not that you have to leave your hand on the sink. It's just, for example, we can do it with a glove, and we'll just start exposing you to some of the stuff that we have to live with on our daily life, just so that you can become comfortable. And it will also help us, like help you with the treatment of showing that it's not going to affect you, and the contamination isn't like going to affect your body, because you did mention that you're scared to get COVID, and during these prolonged exposure, it shows that you will be able to control your behaviors and your emotions and bring you to a calmer level. Would you like to continue on with those treatments and start doing the follow-up meetings?
I mean, yeah, it sounds scary, but I think if we took it very slow, I might be open to it.
So we wouldn't, it's called flooding, what you're talking about, and we wouldn't flood you with anything that you're not comfortable with. We're going to work together, and we're going to work at your pace.
Okay. Okay.
Okay. Thank you. And you can meet with Amber to for your follow-up appointment.
Okay. Thank you.
Have a nice day.